Hey guys, Medic Man here. Today I want to do something a little different. I wanted to make a video covering kind of the basics of being an EMT and what it's like and different things like that. I'm also a medical assistant and a paramedic student, and I'm going to make videos on those as well. So if you want to be a medical assistant or you want to be a paramedic, then definitely subscribe to my channel and stay tuned for those videos and leave me some comments if you have specific questions on anything. I'd be happy to answer those. But in this video, we're just going to cover being an EMT basic. So what is school like? School is usually 4 or 5 months long, and it's usually 2 nights a week for, usually 4 hours per night. So it's really easy to work that into your schedule, even if you're super busy. If you're older and you've got a family and a job, trust me, it's doable. When I was in school, I had people that were in their 50s and 60s that were in the class too, and they had full-time jobs, they had kids, they had grandkids. They had 50 million things going on. It's pretty easy to work that into your schedule if that's really what you want to pursue. So what types of things are you going to learn when you're in school? You're not going to learn how to do anything advanced, so like intubation, giving narcotics, or cardioverting patients, all that stuff. You're not going to have to learn any of that. That's going to be on a higher level, like paramedic. So the things you are going to learn are, how to splint broken bones, how to, spinal immobilize a patient that was in a car wreck and place them on a backboard, how to give somebody oxygen, or assist them with their EpiPen, or assist in the delivery of a baby. A lot of just random stuff that's on a basic level. Because when people call 911, it could be for literally anything. From they got a paper cut in between their fingers, or they're having, severe chest pains and they're having potentially a heart attack, and everything in between. So naturally you have to know, because you're going to be the one that gets called to go out there, you need to know at least a baseline of everything, pretty much. So, basically what you're going to learn is basic anatomy and physiology. This is your head, these are your eyes, this is your nose, this is your mouth. And really, that's it. And then you have your hands and your fingers and whatever. I'm being sarcastic, but only a little bit, because it is really basic stuff that you're going to be learning. So it's not going to be anything over the top. Trust me, you can handle it. So if you're thinking about being an EMT, don't run away. You're going to be just fine. Trust me. But those things might sound stupid, but believe it or not, when you look at that from the point of view of a bystander and things like that, so they may sound stupid and mundane, what you learn when you're in EMT school, but trust me, when you're out in the real world as an EMT, you will figure out real quick that being an EMT basic, you know a lot more than a lot of the general public or laypersons will know. So just a random example, EMT versus non-EMT. You got a patient that's at the park. They're allergic to bee stings. They have an EpiPen. They get stung by a bee. Now they're having, the start of anaphylaxis. So you're going to learn a lot of medical terminology. So you're going to learn what anaphylaxis means, so that oh, that's an allergic reaction and not a good one. So you're already off to a great start with just learning medical terminology and what your bones are, the names of them, and different parts of the body, like your eyes and your nose, and different common name medical terms for those specific body parts. But let's say you get called to the park. This lady gets stung by a bee. She starts panicking, she's having trouble breathing, she's fumbling around for EpiPen. A general bystander comes over to help. They're like, hey, you're having trouble breathing. What's going on? What can I do? So they're not medically trained, we're going to say in this example. They don't know why she's having trouble breathing, probably. They don't know how to fix that at all. And they're kind of just stuck. And hopefully, they're not going to do anything weird like start CPR on a conscious breathing patient. But unfortunately, sometimes, bystanders get panicked too. They want to help, they want to do good, but they don't know what to do. So they just try to start doing random things, which could hurt the patient. You, EMT Basic, you show up and, okay, I'm out in an outdoor environment. It's a nice summer day. There's insects flying around. I have a patient here that's having extreme difficulty breathing. Okay, I need to fix that right away. Life threat. What do I do? Oxygen. How much oxygen? 15 liters. What do I use? Non-rebreather. You're already doing great, because the general bystander, it's like, I don't know what a non-rebreather is. I don't know what oxygen administration rates are. So, the mundane training that you're getting as an EMT is actually pretty useful. In the first 30 seconds of that anaphylaxis patient, you've already, recognized the life threat of difficulty breathing, and you've gotten them on oxygen and the appropriate amount through the appropriate delivery device. You want to know why they're having trouble breathing. And, you investigate, you use the tools that you've learned in school, and you figure out, oh, you're allergic to bee stings and you got stung. Okay, well, now what do you want to do? Oh, do you have an EpiPen? You do? Awesome. Now you can assist them and deliver that. So within 30 seconds, you've already got that patient treated, and you're already on the right track to saving their life and preventing them from, escalating to a point where they're going to eventually just stop breathing, go into cardiac arrest. Then that bystander is like, hey, I know what to do now. I'm doing CPR. Don't let the mundane stuff be like, oh, this stuff is so stupid, I'm never going to use it. You're going to use it all the time, and you're going to get really good at it. And when you're out in the general public, you're going to look around, you're going to see people and watch them, and, someone starts choking, it's going to be like, someone puts a bat signal in the sky, and you're going to be like, I know what to do. Doesn't happen all the time, but you have that mindset a lot of times. So if you like helping people and you like to have that critical thinking skill and, help people, then being an EMT is a great career to go into. Especially if you want to upgrade to be a paramedic, or you want to be a nurse or a doctor or anything like that, then EMT is definitely a great starting point. Now, when you get towards the end of school and you're learning all that hands-on stuff and you've been practicing and you've been studying, there'll come a time where you'll do your clinicals. And usually for EMT Basics, it's like 24 hours on an ambulance and 24 hours in an ER. It's going to vary depending on what state you're in. Here in Indiana, I had to do 24 in the ER and 24 in the ambulance. When I got my Virginia certification, I just had to do 24 hours on the ambulance, and that was it. No ER time whatsoever. So it will just depend on your particular class and what your instructor has set up for you. So when you go out and do your field work, you're going to be with, EMTs, you're going to be with paramedics out in the field, and you're going to see firsthand. So you're going to do the basics. You're going to take their blood pressure, you're going to, check their pulse, and, you're going to be doing a lot of handing objects to the EMT and the paramedic. And you may think that's dumb, but there's a purpose for that. You're learning how to function in the real world environment. So, you're going to be the assistant, while you're tagging along. Now, if you prove yourself and you're pretty smart when you're talking with the crew, they might let you do a little bit more. They might let you, do all the vitals and, kind of take care of the patient during the transport, as long as it's like a stable patient that really doesn't have that many, problems going on at that particular moment. So it just depends. And then when you're in your ER time, you're going to follow the nurses around a lot of times, or you might follow around another ED tech, which is usually an EMT Basic. And you'll learn how the hospital does things. So, when the ambulance brings in patients to the ER, they're typically already bandaged and, packaged up really nice. So you may not do a whole lot when you're in the ER doing your clinicals, but you're mainly in there to see what it's like once the patient gets into the hospital. What's the doctor going to diagnose the patient with? What treatments is, that doctor going to do, so that you can kind of see how that's going to play out, and different things like that. So, once you get through your clinicals, then that's pretty much it. You're going to take your national registry test or your state test or both, and then you'll do your hands-on skill evaluation where you have an instructor in a room, you have a time limit, you go in there and you go through a checklist without looking at it and, treat XYZ patient for, whatever reason. And, once you pass both of those, you'll get your certification and, you're an EMT. Now, what you can do at that point is, you have a couple of different options. You could volunteer with a volunteer fire department and provide, 911 type emergency care, unpaid, but, it's great experience. Or you could go work for, a 911 ambulance and see 911 calls. Or you could work for a transfer truck, which typically doesn't see 911 calls. You're usually doing, inter-facility transports, taking patients from a nursing home to the dialysis clinic for their appointment, and then maybe, bringing them back to the nursing home afterwards. Or you may work in an emergency room. So I've actually worked in all of those environments, so I'll touch base on all of them just real briefly. So volunteer fire service type stuff, you're going to see, 911 stuff. So shortness of breath, a gunshot, a car accident, a farming accident for those of you that are in rural country areas, things like that. And you're going to go to the fire station, get in your truck, and you're going to go and you're going to do all your EMT stuff, before the ambulance gets there. So, it's kind of cool to do that. But you don't get paid, but it is great experience. Working for a 911 ambulance, depending on if you're in rural country area or if you're in a city, your call volume's going to, fluctuate. In a city, you're going to have a lot of calls. In the rural country area, you probably won't see a lot of calls. And you'll either do a 12-hour shift or a 24-hour shift. Most places are doing 12s now just to make it easier on you. You typically work 3 12-hour shifts per week, day or night shift. So you get those 4 days off every week, which is pretty nice. So the schedule is pretty lenient, being an EMT. When you are on like a 911 ambulance, you're going to see the same stuff you would on a volunteer fire department. So it's really the same type of deal. The difference is if, it requires advanced life support, the paramedic is going to be in the back tending to the patient, and you're going to be in the driver's seat driving to the hospital. And, that could happen a lot, or maybe you'll get lucky, and a lot of them are really minor illness, injury type stuff, and you'll be in the back and the paramedic will drive. That's just kind of how that works when you're a basic. So, be prepared to do a lot of just driving. Sometimes if it's a really bad call, the paramedic might want their partner, meaning you, to be in the back with them, helping them treat the very unstable, traumatic patient. And someone else may drive, a volunteer firefighter or a paid firefighter, depending on how your service is set up. But someone will get in and drive, and you'll get to be in the back, plugging holes, so to speak, or, doing whatever the paramedic wants you to do to help. Working in a transfer truck, it's not all bad, but you're not going to see, 911 calls. Typically, you're going to take patients from the nursing home to doctor appointments or to dialysis appointments, or you might take them from the hospital back to the nursing home, or you might do the opposite. You might take them from the nursing home to the hospital. So, same, shift setups. It's usually 12-hour shifts, 3 days a week, that kind of deal. If you really like helping people and you don't really care about blood and guts and trauma and stuff like that, then a transfer truck is definitely a great, option for you. Emergency room, that is going to be, you're not going to do a lot of your EMS skills that you learned in class, because when patients walk in or they come in by ambulance, if they come in by ambulance, they've already been treated by an EMT and a paramedic. and then the nurse and the doctor, it's their turn to take over. So in an emergency room setting, you're going to do a lot of, doing EKGs on patients and then giving the results to, the attending physician. If a wound needs to be rebandaged or something like that, or, if patients need help going to the bathroom, or in some cases, a lot of ERs will train EMT basics in IVs. So what that means is you'll be certified exclusively in your emergency room to start an IV. Usually you can't hang fluids or do anything like that because it's technically a medication, so a nurse would have to do that. But if you want to be able to start IVs and do some stuff that you can't do out in the field as an EMT, then working in the emergency room is a really cool option because you'll learn how to start an IV and you'll be legally able to do so. Now, some areas in the country, they do certify their EMTs in starting IVs, so if you're one of those areas and you can already start an IV because you're an EMT, that's awesome. But unfortunately, a lot of places in the U.S., an EMT basic is not allowed to start an IV unless you're working in the emergency room and your hospital has given you the training and the authorization to do that function. So that's pretty much all, the different areas that you may be in as an EMT basic. Pay, it's going to vary a lot. In rural areas, it seems to be pretty consistent, right around anywhere from $9 to $11 an hour. So, it's not super high paying, whether you're in the ER or whether you're, on a transfer truck or a 911 truck. The pay is usually about the same. It's going to vary from time to time, but for the most part, you're looking at anywhere from 9 to 11. Some services may give you, 12, maybe $12.50 or something like that if you have, a lot of experience and things like that. But for the most part, it's not a high-paying job. But if you want to advance, your education and go on to do other things, like be a paramedic or a doctor or a physician's assistant or anything like that, it's a great stepping stone. And if you just like helping people and, you like bandaging and you like splinting, broken bones and you like, triaging patients, like we mentioned in that, anaphylactic bee sting scenario, where you get to use your brain and figure out what's going on with this person and how can I help them, since I'm here and I am the person that's supposed to help. Being an EMT is definitely a great career choice, and I would recommend it to anybody who has an interest in helping people and, the medical field in general and stuff like that. Just remember it's not always, trauma. Sometimes it's slips and falls and they don't even need to go to the hospital. Or maybe they just are old and, their spouse died years ago and they just want someone to talk to. Different things like that. So, be prepared for that. You may make a sandwich for an old lady at 1 o'clock in the morning, or 2 hours later, you may show up to someone else's house and their 6-month-old child, they found him in the crib, they're not breathing, they don't have a pulse. And, it's pedal to the metal. You've got 50,000 things rushing through your head and you have to figure out, I got to get this baby breathing. Mom and dad are watching me. They're screaming at me. I have to stay calm. I have to be collective. I have to do my job to the best of my ability. And with low pay, and chances are my efforts are not going to do any good. And then I'm going to be labeled as, I didn't help somebody. So, always have those things in your mindset because not every call is going to be great. So be prepared for that. Sometimes you have bad calls and that's just part of it. But knowing ahead of time that is a possibility definitely prepares you, better for stuff like that. So that's going to do it for this video. If you guys have specific questions on anything that, I left out, I didn't cover, or maybe I didn't cover it, in great detail, feel free just put it in the comments, and I'll get on there and check them out, and I'll answer your questions. Or maybe I'll make a part 2 video to this, and I'll go over a little bit more in detail of certain areas specifically that you guys had questions on or wanted to know more about. So, if this video helped you in any way, definitely hit the like button, and definitely subscribe to my channel, because I am going to put out more videos, that are medically related, aside from my gaming videos that obviously are awful. But I'll also do like a weekly video on my paramedic school. So for those of you who want to be a paramedic or are in paramedic school yourself, and you want to kind of see how different classes are doing things, or if I know any tips or tricks that I'm learning in my class that maybe you haven't, definitely subscribe to my channel and stay tuned for those videos, and leave me some comments and let me know, what kind of questions you guys have. Alright, thanks for watching, guys. Have a good day, and I will see you guys later.